sit tight and we'll get started in a few moments. Thank you. Hello everyone, take Zoom about a minute to add everybody into the room, so please sit tight and we'll get started in just a few moments. Thank you. Okay, hopefully that's been long enough for Zoom to add everyone. We will go ahead and get started. Thank you everybody for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic and its effects on society. I'm Gregory Phillips with Duke Communications and I'll be moderating this event. An unusually active Atlantic hurricane season is underway and the US is still in the grip of the COVID-19 pandemic. We have 4 Duke experts with us today to discuss the ongoing hurricane season, how a severe storm could affect efforts to contain the spread of coronavirus, and how the pandemic complicates disaster response to extreme weather. I'll introduce our speakers and get the discussion started, then we'll open it up to questions. We are recording this briefing and that recording will be sent to everyone who registered. Thanks to those reporters who already sent questions. During this discussion, those of you joining us on Zoom can submit questions via the Q&A window at any time. There will also be an opportunity to ask questions in person in a few minutes. Thanks also to everyone watching this on YouTube. With us today is Lisa Campbell. She is a professor of marine affairs and policy at Duke's Nicholas School of the Environment, and her areas of study include community resilience and disaster response. Good morning to you.
Good morning.
And we have Andrew Godfrey. He is a medical instructor in the Department of Surgery at the Duke University School of Medicine. He is also an emergency medicine specialist at Duke Health, where he responds to disasters every day. Good morning to you, Dr. Godfrey.
Good morning.
Also joining us is Rett Newton. He is mayor of Beaufort, North Carolina, a coastal town frequently struck by hurricanes, and home to the Duke Marine Lab, where he is a Ph.D. student in the Marine Science and Conservation doctoral program. Good morning to you.
Good morning, Greg. Thanks for letting me join you.
And we have Cameron Wolfe. He is an infectious disease specialist at Duke Health and an associate professor at the School of Medicine, where he studies infectious diseases and biological and emergency preparedness for hospital systems. Good morning to you, Dr. Wolfe.
Good morning. Thanks for joining.
You are all welcome. Professor Campbell, I'd like to start with you. When a hurricane approaches, residents in the affected area have to weigh up whether to stay put or to evacuate. How might the pandemic influence those kind of decisions?
Yeah, that's a great question. And I think there's a couple of ways to approach it. First, I think we need to recognize that some people are unlikely to leave under any circumstances. And I won't say they'll never leave, but they're highly unlikely. And for those people, I think the pandemic is just another reason to stay put. But when we turn to people who are actively making a decision about whether or not to leave, we find there are multiple considerations they make and that these interact. There are questions of economics, how people make their living, how secure that living is, and whether or not it's tied to their property. There's questions of property insurance and the need to be in place to respond quickly to any property damage. There's a fear of getting stuck wherever you evacuate to and not being able to get back. There's questions of pets and even larger animals and livestock. There are decisions about relatives, and in small rural places like Beaufort, where we're based in the Marine Lab, those tight social networks of families really determine what people do. And there are things like past experiences with storms, with evacuation, with experiences in shelter, and all of these things combine together. But one of the key findings that we've had is that health, physical and mental health, already play a major factor in people deciding whether or not to evacuate. And there are trade-offs, things that both deter evacuation and that encourage it. We might trade off things like how difficult or uncomfortable and even dangerous it can be to move people and our ability to find a suitable place for them to go, with things like needing electricity to have oxygen supply or having access to medication or specialized services. So we already have health concerns playing a key role in whether or not people decide to stay put or to evacuate. When you add on to that, concerns about pre-existing conditions really changing how individuals experience exposure to the virus and contracting COVID-19, we have an additional layer of fear and anxiety about evacuating. Of course, that really depends on where you're going and how you're getting there. And if you rely on shelters or buses provided by counties to get you there, these can be obviously really challenging for social distancing. And even if emergency managers are accounting for the need to social distance in shelters, people's perceptions and heightened anxieties will undoubtedly play a role in deciding whether to leave or not. Sheltering, let's face it, is not very enjoyable under the best of circumstances, and it can be extremely stressful already. So when we add onto that a fear of contracting COVID-19, I think you can see how that makes that decision difficult. I also just want to say one last thing is that I've been looking at some of the literature on how emergency managers are preparing, and one of the recommendations is to ensure that people are sheltering in places with low transmission rates to reduce any problems associated with sheltering. But in our case in Carteret County, we have a relatively low caseload. I know there's a lot of ways to make that calculation, but in terms of cases per 10,000 people, we're lower than any of the surrounding counties. And so people deciding to leave are deciding to go to a place where their chance for exposure might be perceived to be higher. So there's a bunch of different things that people are taking into account. And it's a mistake to assume that, it's going to be an easy decision made more complicated by COVID.
Absolutely. Thank you for that. Certainly a lot to dig into there. We'll be talking a lot about evacuation and shelter today. Mayor Newton, I'd like to move on to you for a moment. You've lived through hurricanes as a native of coastal North Carolina, and now you are leading a town through them as mayor. What worries you the most about the next storm possibly hitting during a pandemic?
Well, the decision matrix is still pretty consistent right now. And just to kind of give you a little bit of a background, we know what happens when you have a hurricane that goes south of us, like as Florence did. We know what happens now as a storm that goes south of us northeast as Hurricane Dorian, and the damage from both of those storms. And then most recently with Isaias, we still have some lessons learned from that as well. It was a Category 1, which is, kind of, we're accustomed to Category 1s. But if you look at the damage down at Oak Island, Southport, Holden Beach, we have a lot of lessons to gather from that as well, because storm surge was a real factor because of the time that it hit during the tidal cycle. So, we're getting better as far as knowing what the category is. We're getting better on the path, but still things like storm surge. And we're really working very closely with Dr. Rick Ludick over at UNC Institute of Marine Sciences. And he's got a very accurate storm surge modeling, but then there are other unknowns like tornadoes. So it really is a big risk management scenario. And then you put COVID-19 on top of that, that just complicates things, as Lisa was alluding to. So making that call for a mandatory evacuation is always a difficult decision. In this case, in Carteret County, if we were going to make that decision, they were going to open up 3 different shelters. Typically, they'd open up 1. But you would have one as a normal shelter with social distancing, another shelter that would handle people with COVID-19, and then the third one would be for vulnerable citizens here as well. So that's really complicated, and that needs to go into the calculus on whether you do declare an emergency, whether you do declare a mandatory evacuation. So it certainly has added to our thought process.
Gotcha. Thank you very much for that comprehensive opening, and lots more to dig into there as well. But for now, Dr. Godfrey, I'd like to move on to you. What are some of the ways that our ongoing efforts to manage the pandemic could affect our ability to respond to a severe storm?
Certainly, as our panelists have already pointed out, one of the main things that we are worried about in terms of this pandemic and our hurricane response is our ability to shelter and provide care for patients who require some sort of assistance during a hurricane situation. This year, kind of with the response that we had with Isaias, fortunately, we did not need quite as much sheltering as we thought we would, but our medical support shelters, which generally help and care for people who have higher medical needs than the general shelters, and certainly the general shelters as well, all incorporated an aspect of social distancing. So what that ultimately does is it takes some of our pre-planned shelter sites, which have set capacities, and lowers those capacities and the amount of patients that we can care for in those shelters. Other issues, certainly with COVID-19 and hurricane response this year, are ensuring that families, patients have the proper equipment that they need in their hurricane prep packages. So namely incorporating PPE, hand sanitizer, soap, things like that into the personal supplies that they're stocking at home. And then additionally, there's always the possibility that the staff that goes out and provides support in some of the shelters may actually be called to provide support at their own home institutions. And so it's certainly possible that we're going to be doing more with less this year than we would normally with other hurricanes.
Sure, absolutely. Thank you. And Dr. Wolf, to look at that from the other direction, what are some of the ways that a severe hurricane could affect our ability to manage the pandemic and contain virus spread generally?
Yeah, thanks for the question. And I guess my colleagues have covered some of this already when we sort of think about the practical issues like social distancing within shelters. But I think solely when you think about the things that we're doing at the moment that helps us regulate and stay on top of the pandemic, the first few things that come to mind there are testing capabilities, for example. One of the ways that most hospitals and townships and jurisdictions have strategized their testing is to make it available to the public in places, for example, such as drive-through tents, where we can make it as efficient as possible for people to get a test. But that doesn't operationally make sense if you're also talking about evacuations or weather scenarios. So, cancellation of testing stations, frankly, support infrastructure around laboratories and delays in test turnaround, I think become a real practical consideration. That's already something that in many parts of the country affects us differently. There are some parts of the country at the moment where test turnaround is very efficient, but you would have to anticipate and plan for delays in that regard, both in taking the sample, getting it to the lab processing. We've hinted a little bit at the realities of infection transmission within shelters, but I think the recovery there is also really important. From a COVID transmission point of view, we have to be very sensitive to the fact that often there's, this virus in particular has quite a long lag time before someone would become symptomatic after they've been exposed. So even if an evacuation happens on a particular weekend, we need to be very sensitive that the COVID infection implications may not be felt for a week or 2 weeks down the road. And part of our recovery needs to be pretty astutely aware of that sort of drawn out time delay. The implications actually go far beyond, I think, the actual weather event.
Gotcha. Thank you very much. Thank you to all of our panelists for that comprehensive opening. Certainly, evacuation, shelters, and recovery are the big issues today. Now we're going to move on to questions. So I would remind reporters on the call, you can submit a question directly through the Q&A window if you like. If you would prefer to ask your question in person, then please raise your hand in Zoom and we can unmute you so that you can ask that way. If you're joining by phone, you can hit *9 to raise your hand in Zoom so that we can also unmute you that way. First of all, what I'd like to do, Professor Campbell, I'll come back to you first, but I'd certainly like to hear other panelists' thoughts on this. When we think about evacuation, this is the one of the biggest decisions that has to be made. And of course, storm paths can be unpredictable, right up to the last minute. Given the unpredictability of storms, could the risk of mass evacuations kind of prompting more spread of COVID, does that or should that mean that emergency managers make evacuation decisions a bit closer to the margin in terms of waiting that bit longer to see where a storm's going to go, or and what are the risks also associated with that?
Yeah, that's a great question. I think one of the issues with waiting to the last minute, as our mayor will tell you, a mandatory evacuation order does not mean everybody leaves. So there is that complication. But the other issue with waiting to the last minute is from some places on the coast, it's actually quite difficult to get everybody out in a short period of time because of transportation networks. I mean, we have really one highway for most of the way to get us out. So I think that is an additional complication that can dissuade people from leaving if they think they're going to sit on Highway 70 for a couple of hours on a Friday afternoon or whenever it is. So it is a real challenge. I know with Florence, one of the big issues for everybody was many people might go to the Triangle. And of course, the Triangle had its own rain and tornadoes and some flooding. It was really difficult to know where to go. And in that storm, honestly, there didn't seem to be a right decision. People got stuck if they headed north, they got stuck if they headed south, and they got stuck if they headed west. So I'm not sure, depending on the nature of the storm, I think sometimes waiting on a fast moving storm might make sense. And at other times, there doesn't seem to be a best evacuation plan.
Sure, thank you. Mayor Newton, what's your take on that? Do you think that it would be wise to kind of push as close to a deadline as you can before evacuating to avoid the spread of COVID, or do we have to keep doing what we're doing to keep people safe?
Well, my goal is to get as much information to the community as I possibly can, so they may have to make their personal decisions. As Dr. Campbell alluded, a mandatory evacuation is not necessarily mandatory. So it really is incumbent upon each family to determine the circumstances and make their best decisions. And for me, some of the wild cards are storm surge. And for instance, Hurricane Florence had a lot of storm surge. If you were east facing part of our community or Carteret County community, you were really susceptible to that storm surge, and in some cases, significant flooding. That's how do I get that information to the citizens so they can make their best decisions? The second thing, the real wild card, is also tornadoes. The strength of the storm. During Hurricane Dorian, Emerald Isle got hit in an RV park with a tornado. Fortunately, they had evacuated in advance. So I want to be able to get as much information to the citizens as possible. So as the storm starts to approach, you'll see me ramp up my communications to get that information to them so they can make their best decisions.
Sure, that makes sense. I'd like to move on to our doctors on the call here, where we discussed shelters earlier. And Dr. Godfrey, I'll start with you. Because of the extra measures that we need to put in place in shelters in order to limit the spread of COVID, does that mean that we need significantly more lead time to set up shelters, that we need to adjust our kind of disaster response, with that in mind?
The lead time to set up the shelter, I don't think necessarily changes with the recent deployment I did with ESAIS. The teams that go out and actually set these shelters up, especially if they are using facilities they've used in the past, are able to put these together pretty rapidly. If we're talking about tents and things like that, if we're having to certainly put up more tents to accommodate people, we may need a little more lead time. But generally, we can get the shelters kind of up and functional. The primary concern is that we just have to make sure that we have adequate workflows and paths for patients to and people to come into the shelters, ensure that there's appropriate hygiene, appropriate screening, and appropriate PPE for the shelter staff.
Sure, that makes sense. And Dr. Wolf, you mentioned the potential risks involved in shelters because of the lag time in symptoms showing up from COVID. I mean, how concerned are you that we have a significant hurricane event and people are in shelters, but then we find out after they leave that one particular shelter was kind of a hive of COVID activity, and then you've got people that are spread all over the place, and we don't necessarily have the contact tracing in place to be able to contain that. How much of a risk do you think that is?
Yeah, I mean, I think it depends a lot on what your state or your region's spread is at that time. I mean, clearly, for example, at the moment, our risk in North Carolina is a little less than what it would have been a month ago. If you're listening to this in Florida, your risk may be a little more. So it depends on how much COVID you have in your community at the time. It depends on where people are evacuating from, and also a little bit on where they're evacuating to. But I would say there's two answers that come out of that can be helpful. The first is you need to be very clear, I think, in terms of understanding where people are coming into a shelter from and where they are going afterwards, because it will have implications on contact tracing if you have positives within a shelter. There's no that has to be the assumption that you want to try and continue contact tracing as efficiently and as thoroughly as you would in any other circumstance. I think the other thing to say, though, is that there are opportunities here to be quite nimble, and a lot of our testing capacity, for example, and a lot of our clinical resources are becoming more mobile when it comes to COVID. So, for example, I don't see it as an impossibility to actually have portable testing stations, heaven forbid, within a sheltered facility, such that you actually give yourself spaces within that facility to not only test if someone, heaven forbid, became symptomatic, but move them into different spaces as you need. that does require a little bit of sort of forethought from a lab capability point of view. But you know, that can become an option to actually counteract the disadvantages that inevitably happen from a testing capability point of view. But you've got to be prepared from the outset to contact trace afterwards. That's part of the recovery here for sure.
Sure, absolutely. Thank you. I mean, have you seen that, and Dr. Godfrey, maybe you can weigh in on this too, because you were deployed, that the contact tracing is now seen as kind of part of shelter operations, or has it not really caught up with that since we're still struggling with contact tracing at a national level?
I would say that certainly when people come into the medical support shelters, we collect demographic information, health information, and generally from the medical support shelters, we are discharging those patients via an ambulance or EMS to a location. So we have an ability to kind of track them, know where they are, have working phone numbers. I would assume the same assume the same information is required in the general population shelters as well. Although with ECES this year, we had pretty minimal patients that presented to our medical support shelters. And so the contact tracing piece at that point was not overly burdensome.
Sure, thank you very much. Okay, I'd remind everybody on the call that you can ask questions in the Q&A window. You can type them in there, or if you would prefer to ask a question in person, you can raise your hand in Zoom and we will unmute you so that you can do that. And you can unmute yourself if you're joining by phone by hitting *9. But I'll move on to some of the other questions that we have. Mayor Newton, I wanted to come back to you. There's this notion of evacuation is tricky. Professor Campbell already mentioned about how there are some coastal residents, they're not going to evacuate, no matter what. When you're trying to communicate information to people, do you see any difficulty in reconciling the fact that sometimes you might need to convince people to evacuate, but maybe during the course of this storm or course of this season, there could be a storm that is on the margin and you don't necessarily want people to evacuate because you're trying to avoid people congregating in shelters. Do you see any difficulty? Because, there's been some talk, people over the last few months complaining about medical advice changing because, of course, medical advice has been evolving during this thing. Do you have any worries that it might be harder for people to kind of follow instructions because they feel like they're getting mixed messages? I'm sorry if that question seemed convoluted.
So the decision to declare a mandatory evacuation, COVID-19 is really not going to play much into that. It's crystal clear that if we're going to get a Cat 3, Cat 4, Cat 5 type of a storm here in our neighborhood, that we need to evacuate. And I know our emergency managers have taken into consideration COVID-19, but in this case, you are risking people's lives to stick around. Now, that being said, there's no question in my mind, some people will stay. They just will for 50 different reasons. So again, I need to get the best information that I can so they can make their personal decisions. And the socioeconomic divide plays heavily in this. We knew that divide existed. Hurricane Florence exposed it. Hurricane Dorian widened it. And this pandemic has deepened this socioeconomic divide. And to a degree, it's invisible in Carteret County. There's an astounding amount of hunger that's here. So there are those people that have resources. So when we declare a mandatory evacuation, they can go somewhere and they'll be quite comfortable until the storm passes, then they come back. How about the folks that are not as visible, that are still struggling from Hurricane Florence after Hurricane Dorian? How do we make sure that we are able to get to them, get the information that they need to succeed, get the transportation to a shelter? And as Dr. Campbell had indicated, there are lots of different factors here. Some people are concerned they won't be able to get back. Some people are concerned about pets. Some people are concerned they don't have the money. So there's a lot of variables here, but please don't discount the importance of that socioeconomic divide in these evacuations.
Yeah, can I just build on that?
Please do.
That's a great point, Mayor Newton. And one of the things I think we have to think about is how the impacts of COVID on the economy are going to intersect with evacuation and questions about where people go. So we may have people that previously may have been able to evacuate and stay in a hotel or motel. They obviously have, their own challenges. Nobody, I haven't been to a hotel in how many months, I don't know, but who now economically are not in a position to do that and maybe in shelters. And so I think there's a layering of the kind of vulnerability people have to storms, to COVID, and to the economic consequences of that are really going to make it particularly challenging for some people in ways that other people will still be able to, sort of work around. COVID will be an extra thing to take into account, but they'll be able to manage. I think there's a lot of things that hit the same group of people in the same way and make it particularly challenging.
I'd add to that as well, if I can, that same intersection is also playing out on a medical front, because in actual fact, many of those same people who had food insecurity or perhaps, if we think of our Latinx community, for example, who often fall foul of some of those disparities, are the same people who also get the worst clinical outcomes when it comes to COVID. So I'm so glad that you guys brought that up as an issue, because it's medically a very relevant group of people to think about as well, not simply from their economic implications, which are clear and present.
Yes, and thank you to all of you for discussing the financial gulf that has been widened by COVID, because that was actually in essence on my list to bring up. We're going to move on from there. Dr. Godfrey, I wanted to come back to something you have mentioned about families preparing and having your test kit and adding things like PPE and hand sanitizer to that. And so I wanted to reinforce, we talk a lot, especially in coastal communities, about readiness and preparation. And I'd like you, if you could, to dig in a bit more about just what families can do, what families who are comprehensive about their storm prep kits should be thinking about in addition this year as related to COVID, things that we should haven't had to think about before. And Mayor Newton, certainly you can chime in on this too.
Absolutely. So certainly we recommend that every family have an emergency preparedness kit, food, water, batteries, light sources, things like that. ReadyNC.gov, which is put together by the North Carolina state government, has an excellent list of items that families should have prepared, quantities and things like that. The biggest additions this year are the PPE that are required really to kind of go out in public. So we want to make sure that people also consider putting masks in their prep kits so that if they do have to go to a hotel, if they do have to go to a shelter, if they do have to go stay with family that they've not been interacting with, that they have an adequate supply of masks to kind of see them through that period. And also making sure that there's hand soap or dish soap, hand sanitizer, things like that, so that basic hygiene principles can continue to be followed when water may not necessarily be available, supplies are limited, or services have otherwise been disrupted.
Thank you. Mayor Newton, anything you'd like to add there as you're advising families on their individual preparedness for a storm?
Well, certainly Dr. Godfrey is spot on as far as those people that are evacuating. For those that are staying behind, they need to consider being without power for 7 to 10 days, as we did after Hurricane Florence. They need to make sure they have plenty of food. Many people who decided to stay behind in Florence, we ran out of food, and we were actually going door to door passing out MREs so people could have some sustenance there. Fuel is important as well. So for those people who choose to stay, and we know there will be people, they have to be able to sustain for a long period of time without power, without resources like grocery stores, which were closed for quite a while after Hurricane Florence as well.
Thank you. And Mayor Newton, I'd like to stay with you. And Professor Campbell, you might can weigh in on this question too. It's a question that came in the Q&A from Katie Mosher with the North Carolina Sea Grant. And she asks, how has the new Know Your Zone efforts been received so far this year? And will it help you to provide transportation planning for evacuations? And for anybody that doesn't know, the Know Your Zone is an effort of the North Carolina Emergency Management along with counties in coastal counties. And Mayor Newton can tell us some more about that.
It's hard to say because we haven't had to do an evacuation with the Know Your Zone. The eastern part of the county where Beaufort and the other communities are is pretty sparsely populated. So it may get pretty busy along our primary route, which would be Highway 101. But we really haven't tested that to see if how that's going to work out. The real bottleneck is going to be up around Havelock, where Highway 70 meets with Highway 101. So despite the fact that we are fairly sparsely populated, it will become kind of a logjam up around Havelock.
Sure, absolutely. Thank you. Again, another reminder to our journalists on the call that you can submit questions via the Q&A window or request to raise your hand in Zoom and we can unmute you so that you can ask questions that way. Dr. Wolf, I would like to come back to you, and Dr. Godfrey would also be interested in your take on this. There was a study that came out yesterday, created a new mathematical model that was looking at evacuations from hurricanes. And it sounds kind of common sense, I suppose, but suggested that if communities are evacuating, that the evacuees should be sent to communities with minimal COVID transmission right now, because those communities would be more able to handle and prevent the further spread of transmission in the event that they brought COVID with them. Does that pass the smell test to you? Or do you think that there should be thought when communities are evacuating in terms of where they're going? Should COVID kind of play into the destination for folks that have to evacuate if they have to do so over large distances?
I mean, it certainly passes the smell test as a logical thing to try and do. And I say that emphasizing back to some of the messages that I think Dr. Campbell had mentioned earlier, that currently the coastal communities are in fact some of our lowest transmission areas for COVID. So the reality comes to, it almost becomes incumbent upon us to keep in front of us the sort of epidemiology map of where our evacuation pathways and where our shelter facilities are in relation to their local community transmission, and such that if we get an event that comes up, we have a little bit of forthright planning to say, right, perhaps the shelter in Durham this week is not the best place to be, even though it might have been our first place to go to, but maybe the shelter in, I don't know, Charlotte, for example, may actually be a better place. The reality is that it's often, you do get some weeks of advance notice of when certain counties and jurisdictions are beginning to trend in positive or negative directions when it comes to COVID spread. That's not something that suddenly changes overnight, like the weather events that we're talking about. So I do think you have a little bit of extra planning time up your sleeve from that regard. And yes, I think if facilities exist and the resources are able to enable that sort of adjustment, that's certainly a right way from an infection transmission to try and do it. Clearly easier said than done, because most of our evacuation efforts are planned and we have examples in place, designed around facilities that we know exist and evacuation routes that we've practiced. But you're right, some flexibility there would certainly be ideal. I don't know if Dr. Godfrey wanted to add to that. I mean, what's ideal and what's plausible in the heat of the moment can sometimes be a little different.
I would echo Dr. Wolf's comments, especially his last statement. I think that it's certainly an excellent thing to consider if we have the advance notice and the ability to be flexible. But certainly if things change, especially with storm track, or that something unseen arises and we need to evacuate people to primarily protect life, that we should certainly consider COVID as much as is feasible, but we need to make sure that we get people out of harm's way. And sometimes having pre-planned shelters and fixed facilities where we are best equipped to do that may not always be the best when it comes to COVID as well.
Certainly, that makes sense. Thank you both so much. Professor Campbell, I'd like to come back to you. Obviously, we hope there are no devastating storms this year, but it doesn't take a truly devastating storm to really mess up communities along the coast. What I'm curious about is how recovery from a storm could play out differently under COVID, what the pandemic could do in terms of hindering our recovery efforts if we did get a severe storm.
Yeah, one of the things I've been thinking about is, and the mayor might have some additional comments on this, but is the role that schools have been able to play in recovery. And it overlaps with this question of socioeconomic vulnerability. I know that schools made a real effort after Florence to contact families to make sure they were okay, to make sure that they, the kids had food. The schools play a role in providing food for many students in the county. And they were sort of, I would say, among the front lines of responders here that could really reach out through kids in the schools to figure out where people were and how they were doing, and to really keep track. And I think COVID is really will challenge that role, both because our schools are in, I forget which plan it is, but we have cohorts. We have 2 cohorts. We have an online cohort. Schools are really under pressure managing this new way of delivering education in person and online in our county. And in addition to that, students that when we went online in the spring, some students just sort of, we lost track of them in some ways, that they never checked in. And so I think schools are under a level of strain here in the county from COVID, that some of that functionality that they provided in sort of keeping track of some of the most vulnerable kids in the system is going to be hard pressed. Now, that's not to say they won't make that effort. I just think their ability to play that role is under stress from dealing with COVID since March.
Thank you. And yes, Mayor Newton, I'd also like to hear from you on what you kind of worry about as regards recovery from a storm in the 2020 that we're experiencing.
Yeah, I just want to reiterate what Dr. Campbell said. The schools are on the front lines, so I really depend on the principals and the staff leadership there to kind of let me know what's happening, because a lot of our schools are fed from a great distance away in the rural communities. People kind of lose sight of how vast the eastern part of the Carteret County is, and sparsely populated rural communities where the schools are important. The Boys and Girls Club is really important. The fire stations during recovery become these hubs of information and supplies for these rural communities. So it's really trying to find out who needs what. And our Carteret County School Foundation was really critical after Hurricane Florence in getting supplies to the people that needed to help people that had blue tarps on their roofs, and the same with our churches. So there are a lot of different organizations that have information on who needs what, and it's just a matter of how do we get those resources to those people during recovery.
Sure, absolutely. And I'd like to stay with you for a minute, because I'm glad you mentioned obviously a lot of North Carolina's coastal communities are rural. And we've seen a big urban-rural divide in how seriously people are taking COVID. The lines aren't clear, but there's definitely a difference there. Are you seeing, in your community at least, that people are taking the virus seriously and would kind of incorporate the kind of things that Dr. Godfrey was talking about in their prep for a storm?
Yes and no. There are people that are taking it very seriously, and then there are others for whatever reason are not. And they are meeting in large groups. They're not social distancing, not wearing masks. In some cases, it's a political statement. In other cases, they just feel like they're not at risk. But that being said, there are a lot of people that are taking it seriously.
Gotcha. Thank you so much. I'd like to come back to Drs. Godfrey and Wolf and talk about this idea of medical capacity to respond. And Dr. Godfrey, what kind of, when we have a severe storm, obviously people deploy, you deployed fairly recently, but the deployment of EMS assets from kind of one area to the state to another area to respond to a storm, how might COVID affect that? And how might that deployment, could that deployment affect, ability to handle COVID where in the areas that they were coming from?
Certainly, and that's actually an item I was thinking about in preparation for this. EMS is generally very integral into a community, especially in response to kind of the lower socioeconomic component of many communities. It kind of serves as a link for that group of people to be able to get health care. I will say that in my capacity working with Durham County EMS here in Durham, we have seen an uptick in the number of calls that get kind of tagged as COVID positive in our system that kind of prompt our crews to take some heightened awareness when they respond. And at times can put extra strain on an already frequently burdened EMS system. And that's not just here in Durham, but generally state and even nationwide. Part of what the state does is it builds ambulance strike teams, which are generally composed of several ambulances, a supervisor, they may have an ambulance bus. They typically will deploy in storms when the appropriate requests are made through the state emergency operations centers. And the idea is that you take assets from one community who is not particularly hard hit by the storm and you deploy it to areas where there may be less EMS availability or that the local EMS agency has been overwhelmed. And so certainly with COVID putting a strain on many local EMS agencies, it's not very hard to envision that a large storm that causes damage in a community and knocks out their ability to respond or overwhelms their ability to respond, the ambulance strike teams their deployment may put burdens on the systems where they come from. And so I think that is a piece that kind of remains to be seen as we progress through the fall and through the hurricane season, but definitely not a stretch to say that EMS is feeling extra impact across the state from COVID, and that may play into our response later this year.
Sure. And Dr. Wolf, what do you think as regards cross strain on emergency rooms and hospital beds? Like, how do you think that could potentially play out?
Well, yeah, I was going to actually add on to what Dr. Godfrey had said. I mean, I think not only is it a strain in terms of sheer equipment and people, it's also a strain on resources. You know, we've all had our own interesting challenges with personal protective equipment, for example, even on a simple level, and having to sort of plan ahead in a COVID environment for supply lines there and procurement channels, which are already under some degree of strain, not just to supply the EMS teams that we've just talked about, but frankly to guarantee those different sorts of supply chains than what we would usually think about in, say, 2019 or any previous year. We've done a lot of adjustment of sort of procurement methodology in hospitals and emergency rooms and EMS teams over the last 6 months. A lot of that is fairly immediate decisions to find where we can resource lots of different healthcare equipment and resources. And again, that just gets put under more examination acutely in the recovery of an event like this. So I do think it sort of behooves us to think about what different sort of pieces of equipment, pieces of PPE, devices that we may use more in COVID. You know, do we have channels that enable us to have supply lines of those that would suit a recovery? Is a question I do think we need to ask.
Sure, thank you. And Dr. Wolf, I'd like to stay with you also. You know, we've mentioned with Mayor Newton and Professor Campbell about people staying in place, but obviously there could be the people that stay in place that are already under isolation, or how might kind of existing isolation restrictions and a need to shelter in place during a storm, is there an interaction there that we need to look at or be concerned about?
Yeah, I mean, isolation and quarantine, to remind the audience, you know, isolation is I know you're positive. Quarantine means I think you've been exposed and I'm nervous you're going to become positive and I want to sort of isolate you away from other individuals. You know, part of the big issue is when we put people currently into isolation or quarantine, it's with the assumption that we have good ongoing lines of communication and medical follow-up with those individuals to make sure if they were to become symptomatic, we have care for them. Or if they needed extra clinical levels of support, then we can deliver that. So the challenge here, I think, if you put people under the sort of the isolation that comes from a weather event rather than just the isolation that comes from COVID, is that you need to have some visibility on where all those people are and need to have thought about what does that mean if, you know, if kind of like Mayor mentioned earlier, almost a separate plan for the people who you know in your community are already under those sorts of restrictions, such that you can move and care for them in a way that's COVID relevant. The worst thing that would happen is that someone who's under appropriate levels of isolation not have access to healthcare for COVID specific issues should they deteriorate. But that's a reality that you've got to think about. In fact, I love the idea of having either separate spaces or frankly separate buildings for those who are under quarantine versus isolation versus the general public. I think that's a really smart way of thinking about it.
Sure, absolutely. And let's hope that wouldn't kind of run into the problem of what's ideal versus what's plausible. Okay, we have gone through all of the questions that we had from journalists. So I've got one final question that I'd like each of you to address before we wrap this up. And that is, and it's fairly simple, gives you an opportunity to restate anything that you might like to. As we think about the possibility of overlap between the hurricane season and COVID, if there was one preparation step right now that you could either suggest to state leaders or to local leaders or to individual families, you know, what would that one thing be? And I realize that it doesn't mean one thing at the exclusion of all else, because this is a very, very complicated year and situation, but one thing that you would want people to take away. Mayor Newton, I'll come back to you first, if I may.
Thanks. Thanks for teeing up this softball for me. The number one thing that I need is information. I am not given the information at a municipal level on COVID-19 cases. It is trapped at the county. So since we've been defending against COVID-19 back in March, we have had to depend on rumors, and that's not a way to do business. I need to have information, and I know there are HIPAA constraints here, but we can work around this. We have to get that information at the ground level so that we can take the appropriate actions. So that's my number one wish list, and thanks for asking that, Greg.
Gotcha. Yes, thank you for such a declarative answer. Professor Campbell, what's the top thing that you'd like to address right there?
Well, I think there's a number of things, but one thing from our research done on the coast that I think is easy to overlook is some of the mental health and emotional sort of burden of living in a hurricane-prone place. Florence really took it out of people, and then Dorian hit the next year differentially along the coast. But when we talk to people in community meetings and through our work with North Carolina Sea Grant, it's very powerful, emotional unburdening of their experiences. And I think the layering of COVID on top of this has really got people pretty much, at their wits' ends in terms of trying to anticipate uncertainty and consequence. And I think in schools, in employers, just really being attentive to the levels of stress that people are dealing with as we face the uncertainty of the upcoming hurricane season in this new world of a pandemic. It's always stressful, but it's just layering on a layer of stress that people find quite difficult to deal with.
It most certainly is. Thank you, Professor Campbell. Dr. Wolf, I'd like to come to you. What's your parting shot?
Well, I completely agree with what the mayor said. Information clarity is such an important thing. I would have said that for our response teams, thinking about ways of incorporating COVID-specific level care and planning for the logistics of that. So PPE, mobile testing capability, and like was mentioned, clear lines of communications as to where cases are and where rates are as you move into an event and move out of it.
Absolutely, thank you. And Dr. Godfrey, you get the final word. What would you like people to take away from today?
I would like to encourage individuals to have an emergency preparedness kit available, to think now while the sun is shining, while things aren't super crazy, what their plan would be if they were ordered to evacuate or if they needed to leave, and to try to pre-plan a little bit as much as possible, given the constraints of COVID and everything else the other panelists have mentioned, for what their personal plan would be. I would encourage everybody to visit readync.org. I actually mentioned it earlier as readync.gov. It is readync.org for some tips and items on how to be prepared, so that if we have a major storm or we have to evacuate later on this year, that as much foresight has been given and as much preparation as possible can be done on the individual level.
Absolutely. Thank you for that. And thank you to all of our panelists. We will call it there. Thanks everyone for joining us. Thanks again to our panelists, Lisa Campbell, Rhett Newton, Andrew Godfrey, and Cameron Wolf, for sharing your time and your perspectives this morning. Next week's briefing will look at the longer term mental and emotional toll of the pandemic now that it's been going on for several months. If you'd like to attend that event, please email dukenews@duke.edu. In the meantime, please stay well. Thank you. Let's hope the atmospherics have mercy on us this year, and have a great day and stay safe. Thank you, everyone.
Thank you so much.
Thank you.
Thank you.